Good afternoon, Governor. Thanks very much. What I'm hearing you say again fairly strongly today is that you believe your mitigation strategy is working, that you're content that 614 positive cases, 11 deaths is about where you thought you'd be by this date, April 2nd. But as people have said to me, why not err on the side of caution now rather than perhaps have some major regrets later if there is a surge?
I can start that, and then I'm going to turn it over to Dr. Pedati. She can walk through some of the metrics we've used and why that makes sense. But we have all along really put in place restrictions and orders based on the data that we have, and I think we're starting to see the response from that. As we learn more and we take a look at other assumptions and data that's available, we'll continue to monitor the situation. But again, I would ask other Iowans and you to look at what we've done and what other states have done, and you know, I'm not sure why and when they did what they did. I know that I've based my decisions on data that's been provided to me from the epidemiologist team, the Department of Public Health, working in conjunction with the CDC and other experts across the country. So, Dr. Pedati?
Yeah, thank you, Governor. I think the other two pieces to keep in mind, again, whenever we have something new, we take what we know from other experiences, from other viruses, and we integrate new knowledge as we go along. And we're going to keep doing that, and I can't emphasize enough how important flexibility for all of us and all of our partners are in this response. And I think you've seen, you know, that we've all been doing that as we've moved along. One of the things that I think we recognize about this virus is that it's spread through droplets when people are in close contact, right? So within 6 feet, somebody can cough or sneeze, and those will land on the mucous membranes of other people, and that's primarily how we're seeing this move from one individual to another. And we're also seeing that there seem to be people who live together in whom it spreads quickly, and in the healthcare setting that seems to be a risk. And so what we're trying to do is take into account what we're learning and how to target our efforts and target our resources so that, again, we protect the people for whom the consequences of this illness are highest, and we preserve the workforce of people who are caring not just for these patients, but for all Iowans. And so I think keeping that in mind is important. I think the other piece to keep in mind is that when you think about the use of public health mitigation strategies, which is what we have right now while we await additional tools like medications or vaccines, these strategies have to be put in place carefully and consistently in order for them to be effective. And so in some ways, it wouldn't be enough if somebody just sort of stopped in place for 2 weeks. What we would do in that situation is delay a peak. And what we're trying to do is flatten that peak. It's not that I want to push it out, it's that I want to keep as many people as healthy as possible for as long as possible. And so that's in part why we think about using the strategies we have, and also why I know this has been a hard time for everybody, but it is so important that we all remind each other, wash our hands, cover our cough, and stay home when we're sick.
Last question is going to go to